Welcome to Bloodstain Pattern Analysis. This is the final topic of Module 4. We will begin by discussing the information gained from bloodstain pattern examinations. We will also discuss recognizing how surface texture, directionality, and the angle of impact can affect the shape of a bloodstain. We will also look at the convergence and the area of origin for impact spatter patterns, including identifying low, medium, and high velocity impact spatters. Finally, we will also discuss and identify the various blood pattern types and how they are specifically created. Blood pattern analysis involves the interpretation of blood dispersion. So when working with an examination of bloodstain patterns, we can answer several different questions. From what direction did the blood originate? From what angle did the drop strike the surface? What was the location or positions of persons or objects when the blood was deposited? Was there movement of a bleeding person? How many blows struck that bleeding person? And what type of blow or shot may have caused the bleeding? To understand stains, a few basic physical properties of blood must be discussed. Blood leaves the body and follows the laws of motion and gravity. Both surface tension and specific gravity come into play when blood forms drops. Surface tension is the cohesive forces between the liquid molecules, so the molecules will tend to attract to light-like substances, causing the blood to spread on a surface. Then surface gravity, the force that pulls on a substance, will take in effect, and this gravity at times will pull the blood and cause a drop to be formed. If we think of dripping blood, blood is going to initially trickle downwards, as shown in this slide, the example with the hand with a bleeding finger. That blood is going to grow at the fingertip until the weight is going to be greater than that surface tension. Then a single drop is going to break free. The surface tension is going to pull on it vertically and horizontally, where it's going to settle into a shape. And then once that shape comes into contact with something, it's going to disperse. So blood is very similar to water in this example. The size and shape of a drop or a puddle is going to change depending on the circumstances. The size and shape of a puddle depends on how much actual water is poured. So a lot of water is going to make a very large puddle, where if just a drip is poured, it's going to be a small puddle. Also, if you're spilling water onto a carpet, wood, or a linoleum surface, the shape of that puddle is going to take different appearances. A hard surface is going to retain more of a circular shape, while a carpet is going to absorb a lot of the water and make the edges spread. The angle of impact, likewise, can also have the effect of whether or not the water would be more of a round drop or elongated puddles. All of this is also going to play into how blood drops actually will appear, depending on the angle that they're actually dropped from, the height that they're dropped from. So in this instance, you can see that a small cut might leave a single drop, where a large wound may leave a very large amount of blood. But the height from which the drop falls is also going to affect that shape, in addition to the volume of the blood. So once that drop is falling, gravity is going to cause that blood to spread out. So the higher the drop falls from, the larger that drop is going to appear once it makes impact. Likewise, the surface texture is also going to affect the drop of blood. On a very smooth surface, that blood drop is going to appear like a very smooth sphere. However, if that blood drop comes in contact with a rough surface, it's going to appear more as a spatter. The angle at which that blood is dropped is also going to affect the shape. You can see from this slide, when the impact is to a greater degree angle, the drop is going to become a lot more elongated. So if you specifically look at a drop that occurred straight above the impact surface, a 90-degree angle, it's going to be pretty much circular in the pattern with maybe a little bit of spatters coming off of it. However, if that blood drop occurs at a greater angle, if we look at 40 or 20 or 10 degrees, it's going to become a lot more elongated. And when we look at drops that have this elongation, you can sometimes determine exactly where that spatter came from or where the blood originated from. You can see from these two examples the direction of travel of the blood. And this helps us determine the direction of the blood or where the blood originally came from. If there's more than one spatter that you can work with, you can determine the point of origin. And you can easily see from this example a three-dimensional determination of where the spatters actually occurred from. You look specifically at each drop and then in some instances actually use a string to help guide back to a common point of origin. Using these basic spatter characteristics, stains can be categorized into three different topics, whether they are a passive stain, a transfer stain, or a projected or impact stain. Passive stains are usually clots, drops, flows, or pools of blood, where transfer stains are going to entail wipes or swipes, pattern transfers, and contact stains. Projected or impact stains are going to be spatters, splashes, cast-off patterns, arterial spurts, and expirated stains. If we initially talk about passive stains, this is stains that are going to occur where there's no actual interaction to create a pattern. So we're going to be talking about drops, flows, and pooling. Drops are going to be very free-falling drops, but there may be small satellite droplets from that main drop area. These are going to have very large irregular stains and also might have the small surrounding stains from the satellite droplets. Flows are going to occur from blood trails, usually horizontally or vertically, ending in a pool. The pools or flows may help indicate position of a body at an earlier time. And finally, pools are going to be large areas of blood, which may help indicate where a body or an individual laid for a longer period of time. Transfer stains are going to have very slight interaction, which is what actually creates the pattern. These are generally going to be wipes, swipes, pattern transfers, or contact stains. With a wipe, this is usually going to be created when an object moves through a blood stain. So a good example of this might be where a towel has been dragged across a pool of blood. Swipes occur when a bloody object comes in contact with another object. So this might be where a bloody shirt comes in contact with a wall. Pattern transfers and contact stains are created when wipes or swipes leave actual patterns. So you can see fabric weaves, you could see seams, or in some instances it might be very similar to shoe print patterns. Projected or impact stains will have interaction which helps contribute to creating that actual pattern. So these are going to be stains similar to spatters, splashes, cast-offs, arterial spurts, and expirated stains. With spatters, the stains that are produced by the blood hitting an actual object. There is going to be two different types of stains or spatters that are created in this motion, a forward spatter and in some instances also a back spatter. The majority of the spatter is going to go forward, and it's going to be created with the same direction as the motion of the item creating the spatter. So an example of this might be a foot that's actually stepping into a pool of blood. There's going to be a lot of spatters that are going to move forward. But also, there is usually the occasion to see back spatters. And these are going to be spatters that are created in a reverse motion. So a good example of back spatters might be where a weapon has been shot in close proximity to a person. There might be a little bit of back spatter inside the barrel of that weapon or on the exterior of the weapon. In some instances, there might be back spatter on the hands, arm, or chest of the actual shooter. Splashes may also occur, and these are going to be large, irregular stains with elongated spatters. In most instances, you can also see cast-off stains if a tool has been used to create the actual injury. So these are going to be stains that are created from that item coming in contact and being bloodied by the first hit. But then the item itself is going to continue to have movement. So blood is going to be flung from that item itself. A lot of times you'll see these cast-off stains on ceilings above an area where an individual has been injured. You want to pay close attention to the shapes of the actual spatters themselves. The spatter directly above the individual being hit is going to be round, where once it starts leaving the tool at an angle, you're going to have a little more elongation to it. So one hitting the ceiling at a slightly angled is going to have more elongation to it, and the further it gets away from that item that is bloodied, it's going to have a lot more elongation to it. With cast-off patterns, it's sometimes also possible to determine how many strikes actually occurred. So you can see from this example there were 3 strikes, which each cast-off pattern, there's going to be a little bit less blood on the item. So the first cast-off is going to have the majority of the blood in that cast-off stain pattern, and with each additional strike there'll be a little bit less blood in that cast-off pattern. There's also occasions to see arterial spurts, and these are going to be very large blood stains produced by a pumping artery as it's severed. This is going to create flow patterns, but there's going to be some parallel arrangement to the flow itself. There's also instances where you might encounter expirated patterns, where the spatters are actually created by blood being expelled either from the nose or the mouth of an individual. And usually these patterns are going to have a lot of bubbles into the spatters themselves. Or in some instances, the color may actually be lighter in a red shade due to the dilution of the blood with saliva. We can also characterize spatters according to the velocity of the spatter itself. We can categorize spatters into either low, medium, or high patterns. With the low pattern, the spatters themselves are going to be approximately 3 millimeters or more in diameter. These are going to be caused from your free-falling drops, dripping, some splashes, and some cast-offs. With a medium velocity spatter, the size is going to be from 1 to 3 millimeters in diameter. And these are usually going to be created from blunt force trauma. So, for instance, a baseball bat that creates a blow. High velocity spatters are going to be less than 1 millimeter in diameter. And these are going to be created from gunshots, high-speed machinery, or explosions. This is a good example of a low velocity spatter. Remember, once again, with your low velocity spatters, they're going to be 3 millimeters or more in diameter and are usually caused from free-falling drops, dripping, splashes, or in some instances, cast-off. Your medium velocity spatters are going to be 1 to 3 millimeters in diameter and are going to be caused from blunt force trauma. This is another example of your medium velocity. High velocity spatters are going to be less than 1 millimeter in diameter and are usually caused through gunshots or interaction with high-speed machinery or explosions. This is a second example of a high-velocity spatter. There are also a few other stains to consider. One of these that is very important with your blood stains pattern examinations is whether or not there are actually voids in the blood stain itself. Voids can help indicate where a person stood, if a door had previously been opened or closed, or if items had actually been removed from the scene itself. So your voids are going to be areas in that stain pattern where an object or a person has actually blocked the deposition of the spatters themselves. When doing any type of blood stain pattern examinations, it's extremely important to completely document that evidence. So initially there might be the documentation that is done by way of sketches using a grid or a perimeter rule method. But then most of the time the documentation is going to involve a good photograph of the stain patterns themselves. It would include overall photos, but then also close-up photos with rulers so the actual size of the stains and spatters can be determined at a later time. The photos should show that overall pattern in orientation to other things at the scene itself. Reports may reflect the information about each blood stain pattern area, giving information that's going to help determine the actions that actually occurred during that crime itself. Remember, you need to completely document everything and record the location of all of these patterns prior to any collections that might be necessary for testing. This concludes Module 4.